Hello, everybody. I'm Alexis Brink. I'm a TAP, and I'm very happy to welcome Dr. Valerie Batts today. She will be teaching a workshop for NATAA and a brief introduction. Dr. Valerie Batts is a clinical psychologist who has been providing consultation and technical assistance on challenging inequities to organizations, groups, and individuals since 1984. Dr. Batts co-founded Visions, and she is a TSTA, Teaching and Supervising Transactional Analyst. And we can also see her at Project TA 101, where she was a faculty member. And it's truly a privilege to be with you today. Welcome.
Thank you. It's a privilege to be here and to be with you again.
We're excited for your workshop, and the title of the workshop is Considering the Intersection of Mental Health and Culture. So we will take a few minutes to talk about that. Dr. Batts, how did you get into TA, and which concept is most useful to you and why?
So I first learned about TA, interestingly, when I was an undergraduate student in North Carolina, and we took a course at Central Prison in Raleigh, North Carolina, which at that time had the most young people in prison than any prison in the country. So it was a sad place for young men, mostly all Black men between the ages of 18 and 22. And our professor used the idea of I'm okay, you're okay, to have us support these young men in planning how to do work and study release interviews. And so I learned about TA that way, which is very important to my work since, because I saw the concept of I'm okay, you're okay as a way to talk about equity. And so I got interested in reading Eric Berne's books and the TA books and started to understand TA as a social psychology. And that's how I got interested. And then I learned about the Southeast Institute in Chapel Hill, North Carolina, and became a student of transactional analysis. I did a master's program that the Southeast Institute sponsored that was called Psychotherapy and Social Change. And it was really a focus on how do we create I'm okay, you're okay, with an awareness that has to happen both personally and interpersonally, but also institutionally and culturally. So and that's been the work of Visions, is to provide a framework for thinking about how do we create okayness in a system that is set up in many ways to have some people be okay and some people be not okay. So that's what really brought me to TA and how I stayed there.
Yeah, wonderful, important. And how do you use TA as a method of social change?
Well, so interestingly, and I'll talk more about this when we're at the session, I started reading what the transactional analysts were saying about how do you create I'm okay, you're okay. And I recognized that social change is how do we change the systemic barriers that create inequity. And we used TA as a way of helping people understand personal and interpersonal dynamics, but also understand systems dynamics, and also recognize that we all are part of different cultures, and our cultures also give us messages. So we use TA to help people change and create change strategies at each of those four levels: personally, interpersonally, institutionally, and culturally.
Wonderful. So that really includes all of what TA can offer to institutions as well, organizations. Yeah. How do you see a relationship between mental health and culture? And can you give an example in what you've seen in your work?
So we use this phrase, healing the personal wounds of social oppression, to speak about a link between mental health and culture. So growing up in Eastern North Carolina in the 50s, the cultural message from the society is, as a Black person, you're not okay. That cultural message can be damaging to us in terms of our mental health. it can lead us to feeling not okay about ourselves and to experiencing mental health conditions that traditionally might be seen through a psychiatric label. But I'm thinking of an example of me where I was working with an African American man who was hospitalized for depression. And as I was interviewing and spending time with this person, I recognized that all of the microaggressions and injustices that he had experienced in his life. And as we began to explore those and to look at the rage and anger he was carrying because of that, as well as the sadness, we were able to have him get better through the use of a multicultural, what we call a multicultural lens. So our work has really been focusing on how do we look at traditional psychiatric diagnoses and take into account what are the cultural or institutional barriers that might be leading to this person's dis-ease. Not to discount the fact that mental illness is real, and to say that often we can identify other factors rather than genetics or loss of tragic events that might have happened in a person's life. That it can also be from the world around us. Mm-hmm. Another example is that I was just working this week with a group of folks who were exploring the fact that their church is heterosexist or homophobic. Mm-hmm. And these folks are feeling discounted and not okay, and are thinking about leaving the church. And we were talking in the conversation about the high suicide rate among young folks, and how in the U.S. now that we're having a lot of anti-gay rhetoric happening, we're seeing an increase in the amount of suicide. That's an example.
Mm-hmm. Yeah, thank you very much. Your workshop is also about survival behavior and how we can possibly change it. How can we recognize survival behavior? And can you give an example of how you've seen we can change it or somebody change?
So we talk about survival behaviors as what we do when we're in the position of being in an organizational or cultural context where we are one down, where we don't have enough power in the situation at the institutional level. So we develop certain survival behaviors in order to be productive in that space. And so for an example that I often use is that growing up in Eastern North Carolina in the 50s, we learned you don't make eye contact with whites. When I went to the University of North Carolina my first year, I had learned that. And I was giving a talk. I had to give a spontaneous talk in my class. And I was the only Black student in the class. And I got up and started to give the talk, and I didn't make eye contact. This was outside of my awareness because it was just following through on what I had been taught. And I made a C on the paper, and that I on the project. I'm sorry, on the talk. And so I went to the professor to ask why, and he said, "You didn't make eye contact," among other things. And he says, "And you're just an average student." Oh. Do you see? The survival behavior of not making eye contact resulted in me ending up being seen as not okay, right?
Right.
So I had to unlearn that behavior. And so what we do in our workshops is help ourselves discover what are survival behaviors that I've learned to use that were adaptive in a particular environment, but that when that environment shifts, if I don't change that behavior, then I'm likely to reinforce old notions about myself and others, or old notions about an institution. So that's what survival behaviors are. We definitely want to change them because they minimize our power. Initially they're very powerful because they keep us alive, or they keep us psychologically alive. And then when the system changes, we then need to adjust.
Mm-hmm. So it sounds like anybody can use this kind of information, but who would you think will benefit from this workshop? What kind of counselors, therapists? Everybody. Yeah, I will be there for sure.
Yeah, thank you. Yeah, I think it would be useful for any of us who are interested in personal level healing, ending discrimination and oppression, and or in saving the planet, because there's a whole link that I could make to this and our relationship with the earth, because we're all at risk in relation to that. So I think that it's really important that that we all tried this on, as we say,
Yeah. Yeah.
and learning to other people is essentially what oppression does. It teaches us to some people are in, some people are out. Some people are in. There was a concept called moral exclusion. So I just believe that when we other people, we create disease. And so as therapists or as counselors, as facilitators, if our work is to create equity among folks, this can be useful because this model can apply
Mm.
to any power imbalances that exist. One of the things about TA was about wanting to create more equitable relationship in the client therapist relationship, which is why we have contracts. So that's an example of applied to any of the isms that can help us create more healthy and healing spaces
Mhm.
as well as people.
Wonderful. Okay. And just one more quick minute. Honestly, I could speak with you for hours. It's so interesting and applies to everything also that's going on in our world today. You are the co-founder of Visions, a very important project. Can you just briefly say what the mission is so that people are aware of Visions?
Visions is a nonprofit that started in 1984, and our goal is to create, our mission is to create a world in which differences are recognized, understood, utilized, and appreciated. We know that we in 1967, Martin Luther King said that in the 50s and 60s in the US, we thought that by getting the Civil Rights Act, we would end oppression. But all it did was create the conditions to say oppression is illegal. But it didn't say, what do you do instead? And
Mhm.
so Visions was created about in 1984 because all of the founders had been through the first kind of generation of folks going into desegregated spaces. And we recognized that people didn't have the tools or the skills to know how to create equity. And that's why we started Visions. And we use TA as our model because of the things I have said earlier about the concept of equity being so central to TA
Yeah.
as a philosophy and a treatment method.
Yeah, very important work and certainly very close to my heart too. So for everybody, please look up Visions. And thank you so much, Dr. Batts, for giving this little introduction to your workshop. And the workshop is February 24th from 12 till 2 p.m. Eastern. And I hope everybody will join this amazing workshop. Thank you so much.
You're welcome. Thank you.